According to a recent heart health survey by the Cleveland Clinic, the majority of Americans usually exercise for at least 30 minutes each week, but many are not getting the recommended 2.5 hours of exercise that they need. Joining us today is Dr. Gordan Blackburn, the Program Director of Cardiac Rehab, Cleveland Clinic. Well, Dr. Blackburn, thanks so much for joining us. Well, doctor, why is exercise so important for heart health?
Exercise is beneficial for reducing the risk of developing heart disease. It's also beneficial for reducing the risk of death if you already have developed heart disease. And that can be very significant. We're talking about levels of 25 to 50% reduction in mortality for individuals who have had bypass surgery or who have had stents.
Well, according to the survey, 80% of Americans don't know the recommended amount of exercise. Why?
The reason we don't get that information out there is probably that we get focused in on other things. We focus in on the cholesterol, we focus in on the tobacco, and we fail to appreciate that getting involved with a regular exercise program carries as much benefit as stopping smoking.
So what is the recommended amount of exercise we should be doing each week?
So I think people know exercise is something that I can do, and I may not need direction. If I get out there and do some activity, I'm gaining benefit. But what we're really looking at is a minimum of 30 minutes per day, 5 days per week as being beneficial. And there may be added benefits by going a little bit beyond that, but there's a threshold of that 150 minutes per week on the 5 days.
Doctor, why do you think so few of those surveyed participate in cardiac rehab, even though they know it can reduce mortality rates?
So Betty, I think there's several reasons for this. Certainly, we need a physician referral to get into cardiac rehab for the patients. And in all the hustle and bustle and the severity of going through the surgery and the stent procedure or a heart attack, sometimes that referral is overlooked. So although we're seeing significant benefit as far as reducing the risk of mortality from heart disease, we're seeing only somewhere around 20 to 25% of eligible patients are getting enrolled. So some of that can be the physician referral. Some of it can be individuals thinking that, well, I've had the bypass surgery and I'm cured. I don't need to worry about these risk factors. Yet we find that individuals who don't participate in cardiac rehabilitation have about a 25 to 30% higher likelihood of mortality compared to those who do get involved and stay with a cardiac rehab program.
Who needs a stress test before they begin an exercise program?
Excellent question, Betty. So I think the first thing you want to do is, if you have not been exercising, certainly if you have heart disease, you want to check with your family physician or your cardiologist before you get involved in an exercise program. Let them make the decision whether an exercise test is required or not. So it's not required for everybody, but again, if you have heart disease, if you're having any symptoms of heart disease, or you do have documented heart disease, certainly you want to touch base with your family physician.
Doctor, this has been great. Where can my viewers go for more information?
If you're looking for more information, I'm going to suggest that you go to clevelandclinic.org/loveyourheart.
Doctor, thank you so much for being on the show.
Thank you, Betty.
And stay with us, and we'll be right back after these messages.